The local effect is limited to the site, that is the area where that medication is administered. That means the tissues immediately surrounding where that medication was administered are the cells that are going to be affected by this medication. Whereas a systemic effect is felt throughout the body, and most diseases are treated by drugs using the systemic effect. Local effects can be topical, as if I'm giving an antihistamine to prevent itching, or orally, perhaps I'm gargling and I'm getting rid of a sore throat, or I'm getting rid of some sores or growths that are in my mouth. Other ways is maybe I can inject it subcutaneously as a localized anesthetic. Now, these same medications that I can give, maybe I'm giving the antihistamine. If I give it systemically, it will affect the entire body, so it'll cause an antihistamine effect. Perhaps the patient's having an allergic reaction. If I'm using something like an anesthetic and I've gargled and I can do further than just localizing or numbing the throat, if I give it injectable, then the entire body can have the effects of that same anesthetic agent. Let's look at the different effects of these medications. One of the effects is called the therapeutic effect. The therapeutic effect is the reason that the medication is prescribed in the first place. It's intended to either prevent a disease, to diagnose a disease, or to treat a disease by controlling, improving, or curing the symptoms associated with that disease. It's directed toward a specific area of the body, that is the target organ, and it can be directed towards abnormal cells, abnormal organisms, or abnormal substances that are present in the body at that time. Sometimes a therapeutic effect happens because of a side effect, and a side effect becomes a therapeutic effect. For instance, antihistamines are originally designed to prevent an overactive immune response, but it turns out one of their side effects is sleepiness. And now, under certain conditions, an antihistamine might be prescribed as a sleep aid. Side effects are non-therapeutic effects of the medications. No medication is entirely safe, and no medication is without potential side effects. Now, these again are the effects other than the therapeutic effect, and they may be mild and temporary, they can be moderate and annoying, or they can be severe. They can be so severe that that may have the FDA pull approval of the medication. So the examples of side effects are very wide. Some medications produce very few side effects, while others are associated with at least 2 very common adverse or side effects. Some examples of gastrointestinal side effects include, very commonly, these are very common, nausea and vomiting, anorexia, diarrhea, and constipation. Many drugs cause those GI effects. Another example of side effects are from the anticholinergic medications. And a good mnemonic to remember some of the side effects of anticholinergics are the abbreviation ABCD. And these mnemonics are a good way to remember things. In this case, we're going to remember anticholinergic side effects, B, blurred vision and bladder retention, C, constipation, and D, dried mouth. The anticholinergic drugs work against the parasympathetic response, and these are the unexpected or side effects that occur when I'm trying to block the parasympathetic nervous system response. Another example of side effects are from chemotherapeutic agents. These include, again, nausea, vomiting, and hair loss, and depression of bone marrow. This is because the intended target are tumor cells, and tumor cells rapidly reproduce. GI cells and hair cells are some of the more rapidly reproducing cells in our body, and so they're highly affected. Now, the FDA does not take the drug off the market because of the life-threatening cancer is more of a concern than these terrible adverse effects. Adverse effects are severe side effects. They are not as commonly observed as side effects, and many of them become apparent only after the medication has been on the market for a while. If they get bad enough, the adverse effects can cause the FDA to remove the drug from the market. However, sometimes it's so unusual and seemingly unrelated to the medication's therapeutic effect that it can be years before there is a correlation between these effects and the administration of this medication. A good example of this is the medication known as propoxyphene. This is Darvon. Now, this was on the formularies for up to 50 years when new research at the beginning of this decade revealed that there was an increased risk of heart attacks and strokes because of using this medication. So therefore, that outweighed its analgesic benefits. The FDA pulled the approval after 50 years. If the adverse effect is severe enough, but the therapeutic effect is still desired, that may warrant a black box label. This is included if that drug is associated with an adverse effect. But remember, that the therapeutic effect outweighs the effects of the adverse effect. It must be included in the medication guide and in any magazine or television advertisements. And this is an example of a black box warning. Now, the FDA maintains an adverse event reporting system, or AERS, database. It's maintained by the Food and Drug Administration, and healthcare providers, pharmacists, and drug manufacturers all contribute. They report the adverse effects that they note in their patients. Another system is the Medication Error Reporting Program, or MERP. It's maintained by the Institute for Safe Medication Practices. That also has an abbreviation. That is the ISMP. Another effect to consider is what's known as the toxic effect. And this is when simply there's too much of that chemical in the body and it goes from being therapeutic to being essentially a poison. If the drug's serum levels rise above therapeutic level, this is considered a toxic level and can cause toxic effects. Before FDA approval, the drug company must show that a drug does not produce toxic effect when it's administered in therapeutic doses. In other words, that will take extra large doses to produce a toxic effect. The therapeutic index, remember, is the narrow margin of safety between the therapeutic dose and the toxic dose in a lot of different medications. There can be too little of the medication. That's known as a subtherapeutic level. If the medication has a low therapeutic index, it's not uncommon to see toxic symptoms because it's very difficult to safely administer medications with that narrow of a therapeutic window. If toxic symptoms occur, the medication's dosage might be decreased. There may be an increase of the time between dosages, or the medication may be stopped altogether. If a patient is on a medication that is known to frequently cause toxic effects, they will be scheduled to have frequent lab tests to monitor the level of those chemicals in their blood. Good examples are things like antibiotics. Good examples are things like anticoagulants. The patient will be in danger for things like hearing loss or bleeding, and so blood tests will monitor how much of those medications are in the patient's body, and the dosages or the frequency will be adjusted accordingly. Another type of side effect is known as an allergic reaction, and this occurs when a release of histamine happens because the body does not recognize that chemical as something that is itself. So it creates an antibody for the antigen. The antigen is the foreign body. That antigen initiates an antibody response against it. Now, this can be things like pollen, dust, or a drug. Allergic reactions don't happen in everyone because not everybody reacts the same way to these chemicals. We say that those people are sensitive or hypersensitive to that chemical, and we use caution when a person has a known allergy. That's why some people can take penicillin and others cannot. The range of these allergic reactions can be anything from very mild itching, swelling, redness, and sneezing, all the way to significant bronchospasm, edema around the mouth and the throat, and even shock that can lead to death. This is known as an anaphylactic shock. It is the most severe symptom of an allergic reaction. Another effect to consider is what's called an idiosyncratic reaction to the drug. And this is a drug reaction. It's not a side effect. And it's not based on an allergic reaction. And it's an individual's unique reaction. And essentially, it is based on the unique genetic makeup of the individual. Syncratic reaction is something that is unexpected that happens when the drug is given. Perhaps I'm giving a medication like an opioid. One of the effects of opioids is I'm going to calm the patient's central nervous system down. In certain cases, an idiosyncratic reaction will have the patient become stimulated as if they've been exposed to caffeine. That would be an example of an idiosyncratic response. Ethnic groups have well-studied idiosyncratic reactions. I'm going to use a branch of medicine known as pharmacogenetics, which study how the genetic makeup of different peoples affect their response to certain medications